It's a paradox. Never have more people been better off in material terms than they are today, but never have there been so many poor people, and their numbers are swelling. 50 years of development have yielded a lesson. New investments, inventions and businesses will do little for the poorest and those marginalised through race or conflict unless they feel they're part of society. Experts call this social inclusion. They say if development is to pack a punch, it needs to include the millions who feel they have nothing to gain from the system. In this week's Hands-On, we look at a range of ideas which give people who have been excluded the chance to pack a punch by giving them the chance to make their own choices. Indonesia, 1998. Riots and demonstrations shake the whole country. After 32 years in power, President Suharto is finally toppled. 1999, the first free elections in 44 years. But 3 decades of authoritarian rule have left Indonesia in crisis. Corruption was rampant and government projects so mismanaged that people had become disillusioned with any public works programme. Yet with millions of rural poor below the poverty line, the priority was getting money direct to those most in need. The Kecamatan Development Programme, or KDP, was set up to do just that.
Getting the money to flow directly is really important in KDP. It was designed that way so that the money would go directly from the regional Treasury Office of the government into accounts held jointly by villagers with countersignatures by consultants in order to assure some control over the funds. But the villagers own the bank accounts.
The scheme, set up in 1998, aims to deliver $700 million in loans direct to the Kecamatan, a sub-district of up to 25 villages. So how do they get the money? Each village comes up with 2 proposals and is then given a grant or loan to fund small-scale infrastructure projects or income-generating activities. Kedang Keras village was one of the first to receive a loan 3 years ago. Like many of the others, their biggest daily headache was lack of access to water.
People went down to the river, but the river can also be dry, so it was difficult. In the meantime, I built a well beside my home, which was enough to meet my own needs.
Seeing the potential of Ibu Ramiem's well, villagers came up with the idea of installing an electric pump to pipe the water around the village so everyone could have access. The money was given on condition the villagers give up their own time to install the pump and pipes. The project is designed to be sustainable, so those who want water piped direct to their homes have to pay 7,000 rupees a month for electricity to drive the pump. So far, 42 homes have signed up.
When we started it, we had those proposals discussed in a joint meeting, and the women weren't talking enough, and their decisions were being second-guessed by the men sometimes. So now we have separate women's meetings, and they decide on their proposal.
Involving women is crucial to the project. At first, getting the women to take part wasn't easy.
More than half of population are women, and they have brain that have ideas. If we didn't involve their ideas in the project, in the development, it's not very effective. Of course, this is the new for women. I think the new thing for women. Sometimes they say, "Oh, we let men to make decision." But if I ask them, "Do you have a problem?" Of course, we have a problem. So men always know your problem. No, so you can say your problem and make a proposal from you, for example.
Whether proposals come from women or the whole village, most are about basic needs. Pumps and pipes for drinking water, schools for primary education, and roads or bridges. Sugasi Wahuni was in charge of building a bridge.
The stones were carried from the forest with a cart, which was very difficult because there was an old bridge.
The process began by destroying the old bridge and putting in foundations for this new bridge.
Encouraging communities to do it themselves doesn't just increase local skills, it also helps curb corruption.
And issues of so often bad services provided by contractors, we thought we needed to start with a rule that said you cannot use a contractor. So if villagers propose a road or a water system, they have to build it themselves.
As manager of the project, Sugasi had to make sure all the accounts were kept in order.
That's why we set up a financial management project to help them, to give them explanation about how to use money and how to make accountability report. This is the new lesson from community. So at the beginning it's difficult, but after they follow the process, they can understand and they can do it.
Since 1998, about 19,000 kilometres of road have been built, and the impact is already being felt. Perhaps most important, people believe in a process that involves them and works.
At the beginning, it's difficult for them to be trust. That's I have experience when I was sub-district facilitator. I said to them, "Oh, money will come directly to you." "Oh, is it right?" That's the response from them. But after they follow the process, and they starting to believe that a process can be helped.
Ecuador is rich in resources, but more than half its people live below the official poverty line. The country is still wrestling with its colonial inheritance and a legacy of bad government. Half the population live in dire poverty. Nearly all are either Indians or people of African descent who worked in plantations on the coast. Sidestepping bureaucracies and injecting funds directly to help the poor decide how they're going to improve their lot is the challenge. A project called Prodopine, set up by the Ecuadorian government with support from the World Bank, is taking the lead. Communities along the Mira River at the foot of the Andes faced ruin when a dilapidated irrigation system failed and no crops could be grown.
Estaba la tubería vieja. Cada 15, cada mes.
The old pipe used to burst every fortnight, every month.
Entonces no se
It was
podía
impossible
sembrar
to
nada.
cultivate anything.
O si se sembraba,
We used to lose our crops when we attempted to
se estallaba
cultivate.
un tubo, se perdía las siembras.
We depend highly on
Siempre
agriculture.
estamos en la agricultura.
To look for options in the big cities is not convenient.
Porque
There are no
para
jobs.
salir a la ciudad no conviene. No hay trabajo.
La gente empezaba como a desesperarse porque
People were desperate when the crops were drying up, dying. Looking for an income to help their families took them to other areas of the country. Some families had small plots of land in which they lived and worked for more
para la
than 20
manutención de
years.
la familia empezaron como a migrar a otros sectores.
Prodopine realised a new irrigation system was the best and most practical way to help these Afro-Ecuadorian communities, who make up some 6% of the population.
When we go out and discuss the social development principles of inclusion, cohesion and accountability, we get lots of support. Everyone tends to agree that those are extremely important. Our challenge is now to turn them into practical things.
The World Bank provided 50% of the funding, with the government, local NGOs and communities finding the rest. Matching finance gave local people a real stake in the project. The World Bank is better known for mega loans to governments. It says it's now promoting what it describes as social inclusion. The idea is that people will be more willing to get involved and be accountable for the money being spent.
Algunas personas que habían salido cuando este proyecto de canal de riego se nos destruyó.
Many people left when the old pipe burst, but thanks to Prodopine, many people are returning with great confidence because the new system is in perfect condition.
Al apoyo del Banco Mundial, al Prodopine, ha retornado la gente y hay ahora bastantísima confianza porque el sistema ha quedado en perfectas condiciones.
Where there's
En donde
water,
hay
there's
agua,
human life.
ahí existe
Water
el
is
ser humano,
indispensable.
porque es un líquido indispensable.
Water was also an issue for another poor community. Faced with wastewater and sewage flowing untreated into their lake, the villagers themselves came up with a scheme to create a network of ponds and aquatic plants to cleanse the wastewater before it returns to the lake. The sewage first flows into tanks where low levels of oxygen prevent it from fueling algae growth. Here, up to 40% of the solid waste sinks. It then flows to other tanks where it's purified further by aquatic plants such as water hyacinth. The plants themselves have a dual purpose.
Entonces, estas plantas lo que hacen es absorber todos los contaminantes o nutrientes que están contenidos en esas aguas y los transforman en forraje rico en proteína, por lo cual vemos ya un uso potencial en la elaboración de alimentos balanceados para animales menores.
Once it's 90% clean, the water can be used for irrigation. The remainder returns to the lake through wetlands where the last of the pollutants are removed naturally.
We all got together to get this project ahead. We hope that this innovative project will be a good example for others to implement around the lake.
It appears to be working well, but one scheme in one village won't clean a polluted lake, so the biggest test is yet to come. Will this example be followed by neighbouring communities? Sarajevo's National Library was an early victim of the war that ravaged the former Yugoslavia. Almost a decade on, repairs to the city's bullet-ridden and shell-shocked buildings are nearly complete, but the human scars are less easily healed. More than 10,000 people in this city of 350,000 were killed, and peacekeeping troops remain a daily reminder. According to the World Bank, up to 40% of the country's hospitals were badly damaged, and a third of its medical professionals were either killed or fled. The healthcare system became overwhelmed by the urgent psychological and physical needs of hundreds of thousands of war-wounded and traumatized people. 5 years ago, the World Bank approved a $10 million loan to the government's pilot project to develop a new healthcare system for post-war Bosnia and Herzegovina.
Although the war brought destruction, death, devastation, horrible things to the sector, to the country, to the people of Bosnia and Herzegovina, it did create the opportunity for us to help the country build a new, much more efficient system with much more equity.
The new healthcare system is moving away from costly and inaccessible city-based hospital treatment. The loan has funded ambulantes, small state-of-the-art clinics. The ambulantes can deal with 80% of all patients' healthcare needs.
The objective of this project was to change the emphasis and to retrain the doctors into what we call general practitioners of family medicine that are able to address the problems of the whole family rather than just children or just women and so on. So the concept of family medicine is a delivery model of primary health care which has proven to be quite cost-effective.
It's an innovation tried and tested in the developing world. Most problems, from diseases to flesh wounds, don't need specialists. The clinics can bring effective and wide-ranging treatment to remote communities. Dr. Batic Mujanovic has completed her 3-year retraining program and is now passing on her skills to a first-year student at the Faculty of Family Medicine at Tuzla University.
I chose to be a family medicine doctor because I like to work with my patient, to have a primary contact with them. Very important to have my family doctor because my family doctor knows everything about my medical history. It is very important. Sometimes I even wait for a week when she is not available or when she is not in the town. If it is not matter of urgency, I would wait for a whole week until she comes.
So far, 31% of all doctors and nurses from Bosnia and Herzegovina have been retrained under the project. Now these local doctors are taking over the teaching.
As patients said us about family medicine, they are very satisfied because in the first time they can find doctors who can understand their needs, he can understand how they suffer.
It's still a pilot project in both the Federation of Bosnia and Herzegovina and the Republika Srpska, the two entities previously at war that now make up the country. A new approach to healthcare offers common ground and may be a bridge of sorts to a more peaceful future. The respective health ministers meet regularly and primary healthcare is a safe topic for discussion.
We talk to each other on the phone very often, and we meet each other very often in different health facilities, where we discuss the next steps to be taken in the health sector.
For
sure, this project contributed to increase the flow of cooperation between the entities and ministers. In general, we can say that the situation in Bosnia-Herzegovina is improving and is more relaxed.
This doctor and nurse are on a weekly visit. They can now spend a lot longer with their patients and bring them the medicines they need. Under the previous health system, this elderly husband and wife, one recovering from a stroke, the other coping with long-term rheumatoid arthritis, would have been resigned to living apart in hospital beds.
As a nurse, I now have more responsibilities, and we are in much closer contact with our patients, and we spend more time with the patients, which was not the case before.
You talk to nurses and doctors, and the enthusiasm that they have is reflected in how they perform. And when you talk to patients, I mean, they're clearly very enthusiastic about having a relationship with a doctor, being able to make a phone call and ask for an opinion or for advice for a medical condition of a child, and make a decision whether they actually have to visit.
Each health centre and field clinic supported by the project has been equipped with a pharmacy and spacious waiting rooms. Appointments are scheduled to allow doctors more time with their patients. This group of patients with high cholesterol are attending a workshop on preventing illness, another important part of the project.
The war and post-conflict brought also a lot of psychological trauma, and the model of family medicine that is implemented through Basic Health Project actually helps patients establish better relationship with their family doctors and express themselves, and therefore help the healing process.
The experiment is not only making healthcare more widely available in the short term, in the longer term it's demonstrating that wars do end and reconstruction can happen. In Afghanistan, decades of war have taken a heavy toll, and the rule of the Taliban brought in many repressive laws, particularly for women. Girls were excluded from education and forbidden to take jobs. A teacher training centre for women that started in Pakistan has now relocated to Jalalabad in Afghanistan. It aims to bring support directly to the desperately needed female teachers.
I want to work if I can, but I'm unemployed now.
Women were at home during the Taliban regime. They were deprived of education. This situation was very harmful to our education system and damaged it very badly.
This teacher training program, supported by the Swedish Committee for Afghanistan, opens a new chapter. Since it began, about 450 women teachers have graduated from the course.
I have learnt many new things, and I will be able to use them in teaching. Before we just had students, but now we're trying to get them to participate more. 80% from the student and 20% from the teacher.
The women are given lessons in teaching skills and a wide range of subjects.
In teachers, we have two major problems. The first problem is the lack of subject knowledge. And the second problem is the lack of professional knowledge. So to cope with these two major problems in Afghanistan on teachers level, this project was designed. And when we cope with these two problems, it ultimately contribute to the learning achievements of students, and it enhance the learning achievements of the students, which is the ultimate goal of an education program.
Education is essential for a well-functioning society, but the Afghan school system was one of the first casualties of conflict and religious fanaticism.
The main purpose of this project was to upgrade the education level of female teachers and also enhance their professional knowledge. This will contribute to the learning achievements of students in Afghanistan.
We have learned how to ask questions and how to answer questions, methods of teaching for children from years 1 to 4.
The main purpose of this project was to upgrade the education level of women teachers and also to improve their professional knowledge. This project will play a very important role in the reconstruction of the country, because educated women can make a difference in the economic and political reforms of the country.
This kind of assistance direct to the teachers may raise educational standards, improve life for the next generation, and provide a hands-on example to other communities of what can be achieved. Malawi in southern Africa. The battle here is against decades of bad government and grinding poverty. Malawians have a life expectancy half that of a rich country. Small rural health centres are the only option for medical care. But patients are unhappy with their treatment. Until now, there's been little opportunity for feedback. Now a new scheme is giving patients and their families the chance for hands-on involvement in the running of their community health centre.
What the project is doing basically is to also try to bring about interface between the service users who are right holders and the duty bearers.
A simple scorecard system helps patients evaluate the quality of service from the local health centre. Staff members also get the chance to evaluate themselves.
Be able to give feedback to the people that are serving, to say, this is how we see us offering our services to you. And then the community should be able to give them feedback as well, to say, this is how we see you doing your services, and then come together and resolve a better way of doing the services to the community.
At the women's meeting, they agree the health centre staff members have improved their listening skills and that confidentiality is more reliable than before. But some of the staff score zeros for attitude and for care given to starving children. Meetings like this are held in every village, and in each case a village health committee has been elected to present the results to the health centre staff.
I am the chairperson of the committee. I realize that we, as members of the committee, are a bridge between the community and health staff.
I never knew that this health centre belongs to us community members, and this encourages me to play a role in the running of the health facility. Previously, a lot of mothers used to give birth within the village at traditional birth attendants, but now they know the importance of coming to the health centre through the kind of work that we are doing, and as a result, maternal deaths have been reduced.
The uptake of certain services have improved, simply because people in the communities, they are able to discuss the issue. They are able to assess their needs, and they are able to prioritize solutions to their problems.
In one community member said, it is good to work in this project because what you've done is you've taught us how to fish. Instead of giving us fish, you're teaching us how to fish. So to them, they think it is very good because even if the project phases out, they'll still remain with the skills and the sustainability will be there.
It was designed that way so that the money would go directly from the regional treasury office of the government into accounts held jointly by villagers with countersignatures by consultants in order to assure some control over the funds. But the villagers own the bank accounts.
Enten Pondok Cabe Jakarta.
Nyambut gawe napa?
Nggih mengdo buruh sedaya kalih sing siji nggih. Pokoke nggih do buruh ngoten mawon.
Terus
Of course, this is the new for women. I think the new thing for women. Sometimes they say, "Oh, we let men to make decision." But if I ask them, "Do you have a problem?" Of course, we have a problem. So men always know your problem. No, so you can say your problem and make proposal from you, for example.
Sehingga dapat mengangkut hasil-hasil pertanian serta bermanfaat sekali untuk mengangkut air yang sangat menunjang kehidupan kami. Demikian.
At the beginning, it's difficult for them to be trust. That's I have experience when I was sub-district facilitator. I said to them, "Oh, money will come directly to you." "Oh, is it right?" That's the response from them. But after they follow the process, and yeah, they starting to believe that the process can be happy.
Cuando estaba la tubería vieja, cada mes era que explotaba el agua. Entonces no se podía sembrar nada. O si se sembraba, se estallaba un tubo, se perdían las siembras.
La gente empezaba como a desesperar.